Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How angioedema is diagnosed. A healthcare provider can often diagnose angioedema by examining the affected skin and reviewing your medical history. However, further testing may be needed to determine the type of angioedema you have. /r/n/r/n angioedema that is caused by an allergic reaction is normally diagnosed based on the appearance of the skin combined with a history of exposure to a substance that could have caused an allergic reaction. Sometimes, blood tests can support the diagnosis, but results are not specific in terms of associated abnormalities. Hereditary forms of angioedema may be diagnosed using a blood test or genetic test. /r/n/r/n You can check yourself or your child for angioedema. Usually, the signs you would check for are clearly visible on the surface of the skin, so you do not have to search for them. /r/n/r/n Another way to check if you or your child has angioedema is to look at the list of ingredients of prepared food that you have consumed, in case it contains something you or a close family member has been allergic to in the past. /r/n/r/n There are two main types of angioedema, /r/n/r/n While the symptoms are similar, the diagnostic tests that confirm each type are different. /r/n/r/n Generally, histamine-mediated angioedema is a diagnosis based on your healthcare provider's evaluation of your symptoms, your physical examination, and identification of an allergen. An allergen is a substance that triggers a strong immune reaction. Histaminergic angioedema is also often spontaneous, meaning that there is no external trigger for the episode of angioedema. /r/n/r/n Commonly used tests in the evaluation of angioedema include /r/n/r/n Sometimes, there is no allergen identified and angioedema may be a diagnosis of exclusion after other causes of the symptoms have been ruled out. /r/n/r/n Nonhistaminergic angioedema is a less common form of angioedema, and it is often hereditary. In addition to hereditary forms, there are acquired forms related to certain cancers, and forms induced by medications, such as ACE inhibitors, a type of blood pressure medication. /r/n/r/n A blood and/or genetic test can help identify non-histaminergic angioedema. However, it is more common to have the blood test. /r/n/r/n Non-histaminergic angioedema can be inherited directly from parents with an autosomal dominant pattern, which means that if a person has the gene for this condition, symptoms of the disease will develop. Because it is autosomal dominant, whichever parent you inherit the gene for angioedema type L, LL or LLL also should have symptoms of the condition because it is a dominant trait. Non-histaminergic angioedema is not a common, affecting only about 1 in 50,000 people. /r/n/r/n Most of the time, angioedema caused by these genes is inherited, but a person can develop the gene mutation spontaneously, meaning that it is possible to develop the genetic changes that cause the condition without having inherited it from your parents. /r/n/r/n Imaging is not normally helpful in diagnosing angioedema. In some situations, particularly when there is shortness of breath or when gastrointestinal problems such as stomach discomfort, nausea, and diarrhea are problematic, diagnostic imaging tests to rule out other illnesses may be needed. /r/n/r/n There are a few other conditions that may produce symptoms similar to those of angioedema. /r/n/r/n A condition that is very similar to angioedema, contact dermatitis, results from contact with a substance that produces a hypersensitivity. The conditions are similar and it may be hard to tell the difference. Acute contact dermatitis of the face is often misdiagnosed as angioedema, as it can cause severe swelling of the facial skin, especially after contact with hair dye. /r/n/r/n Edema is swelling of any part of the body. It can occur in response to an injury or an infection, in which case it can occur quickly and abruptly, similar to the edema of angioedema. /r/n/r/n like angioedema, edema due to injury or infection may also involve only an isolated region of the body. There are subtle differences between the edema, however, including a possible fever and more severe pain if the cause is an injury or infection. /r/n/r/n The edema of heart failure or kidney failure is usually gradual. Most of the time, edema is not the first symptom of these conditions. /r/n/r/n A few important differences are that edema of heart failure or kidney failure is usually symmetric, which does not have to be the case in angioedema. The edema of angioedema is not pitting, while edema of heart failure or kidney failure is pitting edema. /r/n/r/n DVT causes swelling of one part of the body, usually the lower leg. Like angioedema, it may be sudden, painless, and asymmetric. A DVT can cause a pulmonary embolism, resulting in a respiratory emergency. A DVT is not expected to be accompanied by swelling of the lips or eyes. /r/n/r/n Blockage of the flow of fluid throughout the body can occur due to lymphatic system obstruction. This can occur after some types of surgery, particularly cancer surgery. Some medications can produce lymphedema as well. It is usually characterized by swelling in one arm and rarely occurs without a medical history that suggests a lymphatic system cause. /r/n/r/n Angioedema is the abrupt swelling of the deep tissues of the lips, face, arms, legs, neck, mouth, throat, genitals, or gut. Unlike hives, urticaria, which affect the outermost layers of skin, angioedema affects underlying subcutaneous or submucosal tissues. As a result, the area of swelling tends to be larger. /r/n/r/n Angioedema causes large welts with generally ill-defined borders that develop over the course of minutes to hours. The eyes, lips, and cheeks are most commonly affected. There may be skin warmth and pain, although the swelling itself is not itchy. With that said, angioedema often occurs along with hives, which are invariably itchy, and sometimes intensely so. /r/n/r/n Intestinal angioedema is a rare subtype that affects the submucosal tissues of the bowel wall. It can occur with both histaminergic and non-histaminergic angioedema, causing abdominal pain, cramps, and swelling as well as nausea and vomiting. /r/n/r/n Allergic angioedema usually occurs within 60 minutes of exposure to an allergen and lasts for 1 to 2 days. Hereditary forms of angioedema can occur spontaneously and often takes 2 to 3 days to resolve. /r/n/r/n Angioedema can be triggered by a number of substances, environmental factors, and physiological conditions, such as :/r/n/r/n Mild cases may resolve on their own without treatment. Over-the-counter or prescription antihistamines are sometimes used to relieve swelling caused by an allergy. More serious cases may benefit from corticosteroids like prednisone to temper the overactive immune response. /r/n/r/n Angioedema is generally more aggravating than harmful but may cause suffocation if the swelling of the throat is severe. Angioedema can also occur as a feature of a potentially life-threatening allergy known as anaphylaxis. Both situations are considered medical emergencies requiring emergency treatment. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.